Welcome, folks, to Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP, Fargo, Moorhead, where we are adding local color to your airwaves and where we are now bringing you daily reports on the COVID-19 virus. Today, I'm going to be focusing on the U.S. response to this pandemic and where we are today. It's incredible how much the numbers of cases have risen. We have now surpassed the number of COVID cases that China has. Although many people are skeptical about their reporting and how they've flattened the line, we have now surpassed the official reported numbers of the Chinese people's virus. And we are going to be talking today about what more we need to do to adequately respond to the virus, as some places like New York have their health care systems overwhelmed. First, though, I want to thank those listeners who, whether you're following us on social media or listening to us here in the Fargo-Moorhead metro area, are sharing the important information about the virus with your groups, with your friends. We, in this pandemic time, we need to share important information with as many people as possible to save lives. It is all of our duties to prevent illness and death. So thank you for following. Thank you for sharing. And Duke, how can people support our programming?
Yes, and also thank you all for sharing information. It's important to get factual information out there. It takes a lot to kind of weed out the stuff that isn't right, but you keep on doing the research, and we appreciate that. We're trying our best to present you with the most current information, up to the information that we can get locally and nationally and internationally. If you'd like to give us a call and leave a message on our message line, you can call 701-566-0917. Again, that's 701-566-0917. You can leave a message up to 3 minutes long. Give us some tidbits of information we can use. We appreciate that. We might even air it, with your beautiful voice on there. Mm-hmm. If you'd like to email, you can send Cindy an email at cindy@kpppfm.com or me, Duke, at kpppfm.com. Also, don't hesitate to go to Facebook. You're watching a Facebook Live, but those of you listening in the metro area, go to Facebook and go to 88.1 Fargo Moorhead Radio. You can also find us on Mexi-Can and the People's Press Project. Also, go to our website, kpppfm.com. That's where we share our shows and we put more information up there. And you can find the Mexican Crossing Lines, and you can look at the rest of the programming we do. We broadcast for 24 hours a day because we're a non-commercial, non-profit, LPFM radio station here in the Fargo-Moorhead community. If you'd like to make a contribution to our nonprofit, go to kpppfm.com/donate. Help support our work so we can continue to do the program that we're providing you today.
Yeah, we're considered essential workers right now, the media.
That's right.
Because we're bringing people information every single day. And we're really working around the clock right now to make sure that you have the latest information on what's going on locally and nationally. If you are one of the people commenting nationally, let us know what's going on in your community. Amy comments that there are 30 cases in her town and 2 deaths. This is in Parsippany, New Jersey. Wow, New Jersey is really being hit hard right now. And I do believe that there are travel restrictions in that area. So folks, don't go across borders. Let's take a look at the world numbers right now. We are over 500,000 people infected. As of the taking of this screen capture, the numbers have risen even further. We're now at 529,093. Total deaths are 23,956. Italy is up to 8,215 deaths. Spain is up to 4,365. Hubei, China, has 3,169. Iran is at 2,234. We have France at 1,696. The UK has topped 500 deaths. The Netherlands is almost there as well. Germany is over 200 cases, as well as New York, which has now got 281 deaths. Just
Wow.
the city of New York, not the state of New York.
Okay.
New York City has more deaths than the entire country of Germany in terms of COVID-19. The numbers are really starting to rise worldwide. And now Mexico has 475 cases. They're almost at 500 cases when a week ago they had, 3-4 cases in the whole country.
That's right.
And suddenly, over 1 week period of time, they have 400 cases. Once you start extrapolating on the math from there, you get an idea of just how quickly this virus is going to spread. Looking at the U.S. numbers, when I first took the screenshot for this show, it was at 82,612. That's jumped now to 83,672 cases.
Over 1,000 increase in an hour.
In an hour, yes. The deaths are 1,209. That's up over almost 100.
No.
20 some cases of in the last hour. And the recovered cases stand at 1,864. So no change in the recovered cases.
Wow.
The number of deaths still outpacing the number of cases of people that have recovered. Virgin Islands is got 17 cases now. Puerto Rico has 64 cases, 13 just since yesterday. South Dakota is now in the double digits at 46 cases, 5 new cases since yesterday. North Dakota is at 52 cases right now, 7 up from yesterday, 7 new cases. And by the way, remember that we didn't have even 20 cases 3 days ago.
That's right. And there's 11 people in the hospital and there's 58 cases. So it's went up a lot in just a day.
And yeah, and again, there's 11 people hospitalized. This is very important to take note of because as people get sicker and needing, as the numbers of people that have it rise, then the numbers of those that are critically ill and need to be hospitalized will also rise. And we need to watch out that we don't overwhelm our infrastructure, our medical infrastructure here. Minnesota is up to 346 cases, 2 deaths reported. Currently hospitalized 31 people, and only 134 that are no longer needing to isolate.
Boy.
In other states, we see that the numbers are rising. Louisiana has now topped 2,000 cases, 18 new deaths. Massachusetts also topping 2,000 cases, 10 new deaths. In Florida, there's been 6 new deaths. In Illinois, there's been 7. This is just in one day since yesterday. And the numbers of new cases since yesterday are astounding in these states. Florida's up 500 new cases. Illinois is up 673 new cases. Michigan is up 561 new cases with 17 new deaths. The state of Washington has 619 new cases, 15 new deaths. California, a stunning 912 new cases and 15 new deaths. Again, this is just since yesterday. New Jersey is up 2,474 new cases and 19 new deaths. And New York, leading all other states in the country, has 4,772 new cases and 19 new deaths.
I think this information is really important when we go through different states and different regions because we're a society that has family all over the country, all over the world. And we travel a lot. So, you might be really worried about your loved ones, your siblings, your parents that live in other communities. And sometimes it's really hard to get that information. So I think that for us going through these at the beginning of the program, it's very, sad to hear, but it's important that people know what's going on.
Mm-hmm. Brenda is commenting that she heard Mexico has protesters trying to keep Americans out.
Yep.
Brenda, stay tuned. I'm going to be bringing you more details about that coming up in this show. So we've looked at those numbers locally. Let's look at what we are doing in the state of North Dakota. This is very interesting now because we are on the border of two states here.
Yeah.
We're on the border of North Dakota and Minnesota. And one state, Minnesota, is in lockdown. We have stay-at-home orders for the next 2 weeks. Meanwhile, North Dakota has no such lockdown orders. Some businesses have closed and restricted the way they do business, but there is no lockdown orders. And in the state of North Dakota, we're seeing things going very differently than they are here in Minnesota, with the governor of the state even telling folks to take their kids to public playgrounds. One person quoting the governor on their Facebook page commented simply, "Oh my God, no," in all caps.
Yeah.
By the way, this social media post was followed up by somebody questioning whether the governor really said that, and the caveat that he did also make sure that parents brought hand sanitizer. But this poster said, because we all know that that'll prevent the kids from licking slides and touching each other's other kids' faces. And
it's a bad idea. Bad idea.
And someone else comments that, with the reports of how long this virus lasts on metal, it's just a good idea to avoid playground for children because, of course, kids don't really understand social distancing very well. And it's very hard to enforce it with little children. So we're going to see these schisms in the way that one state versus another state is dealing with things. Detroit Lakes put out a request for all criminal activity to be postponed until after the virus. Yeah. How do you think that's going to go, Duke?
But don't do any crime until, later.
You think that'll work out?
I don't think. I think that in seriousness, that we have to get the community to stop doing things. But that part of our society is just not going to stop. They'll see opportunity because of the vulnerability we're having, which is unfortunate. Somebody
posted the request by the Detroit Lakes Police Department on, is it Today? The Today Show? Here's that screenshot. It says, meanwhile, in North Dakota, North Dakota Today.
Oh, okay, yes.
And they're talking about how they would like the activity of criminals to stop during the COVID virus. Well, we would like that to happen as well. But sadly, folks, here's the sad thing I've noticed, not just locally, but also nationally. The crimes, especially of theft, are going up. Have you noticed this on your social media timelines too? One of my friends from high school just had a birthday, and a lot of folks that are having birthdays, graduations, weddings, they're very, very sad right now because they can't have a party.
Yeah, they can't have people together.
Nobody can be together for the birthday party. And the sad part of that, in this case, was that they, one of their friends anonymously ordered them a cheesecake and had it sent to them by DoorDash. Unfortunately, that cake was left on the doorstep, and someone came by and stole it. And I wanted to take this moment to talk about these increased types of crimes and what we could do. How do we brainstorm to avoid them? Duke, how are we avoiding having our groceries stolen off of our doorstep?
Well, we have a lot of trees, and it's not very, you can't see very well, but I'm concerned about that. And because what I do is when we get the groceries delivered right to our door, I don't have them come in, and I have it set up with the local Hornbachers that instructions are just put them on the steps. I'm going to have them start putting them in the back of my car. It's a hatchback. It's right off the steps, so they can walk up to the car, open the back hatchback, put them in there, close the door. I'll lock it from the inside. And that way they won't be sitting out there. Also, we have rabbits and squirrels that are all running all over the place because it's springtime. Also, I clean the groceries outside. We'll say some things about how to do better with plastics and cardboards, but I've already started taking disinfectant wipes, and I take the groceries out of the bag in one area of the back of the car. That's the dirty area. Get rid of the bags right away, and then I wipe down everything with disinfectant wipes and put them in bags I've had stored from months ago. So I just take my old bags I've kept and put all the groceries after I clean them in the other bags and discard the outer bags, and that way I can perhaps minimize contracting this virus. And it's one thing that we should be doing instead of just, a lot of people are still going to the store, and we've got to have delivery services. We've got to stop encountering each other and touching items that other people have touched.
And if you have to go to the store, you need to wipe down your little cart. You need to, wear something over your mouth to cover, and I know that the masks that are being made out of cotton or cloth or other things don't protect you as well. But if you happen to have one of those medical ones that they give you at the office, at the clinics when you go in, it's not a bad idea to wear that and to wear gloves, and then take all that stuff off before you come back into your house, take a shower, disinfect yourself. I like that you keep an area that's sanitary in the vehicle. You sanitize the back of the vehicle where you do this cleaning, and you have a side of the vehicle that you unload everything into, which is the dirty side. And then as you clean each item, as you clean everything, you move it over to the clean side. Another thing that if you're using, let's say a solution of Clorox and water, that you can toss certain things into a bucket with soapy water. If you have a bucket with soapy water that you take out there, say your produce, you can toss all your produce in there, your oranges, your bananas, and then you can wash them, bring them inside, wash them, and everything, will be clean. You want to use the same principles for washing your fruits as you would for washing your hands. Soapy water, 20 seconds, because the fruits are porous like the skin on our bodies. So we want to use the same principles for cleaning those before we consume them. Luckily, on food, the coronavirus does not live very well. So you don't have to worry about consuming the food. And again, you want to use the same principles and apply those to your takeout food. You want to discard all of the wrappings, all of the, the bags, the box, whatever it is, the box, and then use your own plates, use your own cutlery to eat your food. And, going back to celebrations, I think that there is, part of, I guess, our human condition. We want to make other people in our lives feel special, especially at milestones of life like birthdays and weddings and the like. But folks, right now, we really have to forego that. Find a different way of showing someone that you love them. Maybe, request a special announcement for their birthday to be played over the radio. You can do that and leave it a number and leave a message on our call-in line, and we'd be glad to play that over the radio. There's a lot of different ways of doing it, but you have to do it maintaining social distancing. I did see one 5-year-old little girl who was sitting in her driveway on a lawn chair with her mom, and the friends and family of this little girl drove down the street past the house, all honking and waving and saying happy birthday to her.
Yep.
Now, that's a pretty smart idea. Everyone is social distancing, maintaining themselves in their cars. Here in Fargo, however, they had a birthday party for a woman that is in her 90s, for her 90th birthday, actually. And, of course, everyone didn't go into the home. They stayed outside, but it doesn't look like they were practicing good social distancing, dude.
What's wrong with this picture? All the people are huddled together in front of the window. They're protecting her, but not themselves. I mean, that's the idea. It's almost there, but we can't afford mistakes right now. We can't afford mistakes, and we just got to be smarter. We got to be smarter about the social distancing. We got to be smarter about covering our faces. We got to be smarter about sanitizing our hands and washing our hands.
Did you have the video for us of the Fargo flood situation?
Yes, I do. I just skipped to the birthday because we were talking about birthdays. But yeah.
I get it. Fargo, we flood. I don't know what kinds of natural disasters you're dealing with in your neck of the woods, but in this area, there's a flood season. It happens every year. And what it looks like is a bunch of people filling sandbags.
Yep.
I assumed we would just not be doing it, but apparently it's going on.
We have to fill sandbags, but they've got the community out there, and as you see, and this is just today. This video just came out on Facebook today. There's a lot of people. No one's wearing masks. No one are wearing gloves. They're all shoulder to shoulder, hand to hand, and they're filling bags through these machines the city of Fargo has, and stacking them. And volunteers are needed during the flood here in Fargo-Moorhead because our river is going to flood. It's not going to be as major of a flood as that they anticipated before, but they still need these sandbags filled. I don't know how we're going to actually distribute sandbags to the homes that need them and those sorts of things because our social distancing issues. I mean, this is a sure way to increase the cases. I don't know. I don't know what we should do. I don't know what the city should do. Not sandbag? Let homes flood? I don't know. But having a whole bunch of volunteers from the community, shoulder to shoulder, is going to contract the virus and spread the virus. I mean, that's just the reality of this happening today.
Well, and then you compound that with the fact that you don't want people unhoused during a pandemic.
Yes, exactly.
If people don't have a place to, be housed, then how can they stay indoors?
Yep.
And of course, the other scary thing is that as long as we don't get a hold of this physical distance between people and staying at home, which, again, North Dakota's not doing, while Minnesota is the spread of the virus and the overwhelming of our healthcare system. I don't know. Maybe the strategy here is that they feel like we don't have that much of a population, so it's still okay for us in North Dakota to forego the social distancing and continue business as usual.
I don't know, but the numbers have went up so dramatically in 1 week. And that's from like normal daily activities. So it's like having that not taken seriously at this point, we'll see in a week a whole different effect. Well, unfortunately.
Let's take a look at the economic roundtable being held in Fargo. This is going to be an economic roundtable due to the coronavirus. The city of Fargo is going to be hosting this roundtable along with other metro governments and regional business leaders on March 26th. At this event, which will take place today at 1 p.m., it took place, they had the Fargo mayor, a Cass County commissioner, a West Fargo commissioner, a West Fargo planning and zoning director, the Downtown Partnerships president, the Moorhead mayor, the Downtown Moorhead Inc. president, the GM, the Greater Fargo Moorhead Economic Development Corporation's president, the Microsoft Fargo site leader, the Bremer Bank senior region president, all in the same building in City Hall.
They didn't do it virtually? They met all together?
They met in person.
Wow.
The Home Builders Association, the Emerging Prairie Executive Director. And it says at the bottom that in an effort to exercise the Centers for Disease Control and Prevention guidelines pertaining to social distancing, members of the public and the media were not admitted into this meeting.
Well, good.
And they could watch the whole thing at the tvfargo.com, Fargo Access channel. But I think that was such a major fail on their part.
The media and the public can't come, but they have all our city leaders and all the leaders in our community.
And what happens if they catch it?
Oh, that's horrible.
Then it spreads among all of our city leaders, which I think really need to start taking this much more seriously. Because we need them right now.
And like I said, we're not overreacting. We have to react and be as careful as we can, and it will pay off in the long run. Maybe we didn't need to do as much as we did, but since we're not doing hardly any of it, And it's true that this is being moved through the community so quickly. We're going to wish that we would have taken these steps weeks ago that we hadn't done. And we might be uncomfortable, and you might be mad that all of Minnesota, you're not supposed to leave your home. But in a week's time, if people don't spread it, we don't have a chance of catching it. We'll be uncomfortable for a week or two, but it'll still be better than catching this virus.
In Sheila's town, she said they do bear hunts. Residents are putting stuffed bears in their windows.
Oh, okay.
And parents are taking their kids out for car rides to find all the bears. You go to a bear hunt.
I see.
Isn't that cool?
Yep.
Another one of our listeners says that in South Carolina, their DMV is taking people by appointment.
Oh, there you go.
And people are still lined close together outside the building.
Okay.
So maybe it's not working so well. Texas, Petra comments from Texas saying that Texas is going to really take a big blow because people are having house parties, the supermarkets are stuffed, etc. Folks need to stay at home. I agree completely. I think that, we are seeing the negative effects of not canceling events where lots of people are gathered. The perfect example of that is New Orleans, Mardi Gras. Do you know about what happened in Mardi Gras? They didn't cancel the event. They held it. And now they lead the country in percentage of people with coronavirus that are on life support, that are on ventilators. Nearly 30% of their COVID patients are on ventilators, and at the pace they're going, they're not going to have enough ventilators. And we haven't hit peak in this country of the numbers of cases that we're going to have overall. This is astounding, folks. So I hope that even though we are a sparse population, we're considered a rural population, and we don't have that many people in the entire state of North Dakota, that this begins to be taken seriously because people's lives are at stake here. Let's take a look at the Moorhead corona cases that we see in the news. The coronavirus has hampered efforts of a local food pantry as needs spike. And Concordia has asked their students to leave campus, postpone graduation as the virus spreads. That's smart.
Yes, it is.
Some colleges have allowed their students to go back to school, like Liberty College. It's a religious college. It's called the Liberty Lights College.
Okay.
And I know that the students are supposed to be doing virtual classes online from their dorms, but the fact that you're putting all those people together is just very dangerous. So let's go through what you can do. I know people can't find toilet paper.
Yeah.
Now the cleaning supplies are very, very scarce. So this is from Consumer Reports on how you can make your own disinfectants with other items. Is your store running short on sanitizing products? No worries. You probably have what you need at home to kill the virus, the coronavirus. Soap and water. Vigorous washing will kill germs on your hands. Bleach. Dilute bleach germs on counter. Wear gloves. 4 cups of water to 4 teaspoons of bleach. Then wipe off your counters. Isopropyl alcohol works. Don't dilute it. It's safe for all surfaces, but it can discolor plastic. Hydrogen peroxide works too. Pour it into a spray bottle. Then let it sit directly on handles and counters where you want. Toss your cleaning supplies, towels in soapy water to kill the remaining particles. Those are things we still have available.
Yeah, we have some of that. I'm worried because I can't find it. I have a half bottle of bleach, and it's only 4 teaspoons to 4 cups. I have a spray bottle downstairs. I'm going to make that tomorrow and use that when I do the groceries and the outside door handles and when I pick up the mail, those sorts of things.
Alicia tells us that there is a challenge to lick public surfaces. Yes,
Yeah.
I've heard about that in grocery stores. And this is even worse than the one where they're licking toilet seats and handles and things like that, because it puts the public at risk.
Yeah.
And Sherry is responding to this comment saying that she's heard about that behavior, but she believes that it will be charged as a terroristic act. Well, I don't know about that, but I think that it definitely should be viewed as a crime against other people's health. Speaking of criminals, did you hear that Venezuela's president Maduro was charged by the Justice Department for drug trafficking?
Wow.
In an astonishing announcement, the Trump administration said there was a sweeping indictment on Thursday of Venezuelan President Nicolás Maduro and some of his associates on federal drug trafficking and related charges in a major escalation of the U.S.-led campaign to topple Maduro and his socialist government. Attorney General William Barr outlined the charges at a news conference Thursday morning in Washington. Prosecutors also alleged that Maduro and members of his inner circle conspired with dissident rebels from neighboring Colombia to produce and transport thousands of tons of cocaine to the United States. Maduro and his allies pocketed profits, and the rebels received weapons, the indictment alleges. The Maduro regime is awash in corruption and criminality, Barr said. It has betrayed the Venezuelan people and corrupted Venezuelan institutions while the Venezuelan people suffer. This cabal lines their pockets with drug money and proceeds of the corruption. This has to come to an end. The indictment means that Maduro would be subject to arrest if he leaves Venezuela. The U.S. State Department immediately put a $15 million reward on his head.
Oh my goodness!
What in light of this pandemic and everything that is happening, being that Venezuela is expected to be hit by this pandemic particularly hard, what do you make of this indictment and the announcement?
I think when you charge a president of another country with a crime like that, that's pretty major. But at the same time, how do you arrest a president of another country? And I don't think this guy is going to be stupid and come waltzing into the United States. But it's sending a really strong message that that sort of corruption, especially as it affects our country directly with the smuggling of drugs into our country. I think it's really interesting. I think it's interesting they're working on that, and it's like making a very, very big statement to the world that this is not acceptable.
Exactly. Well, the stimulus package finally left the Senate and is now waiting for a unanimous vote in the House.
Yep.
How do you think that's going to go? I don't know as of yet if we are going to get that bill passed or if there's going to be, as President Trump said, some holdout.
Yeah.
But
grandstander.
There was a tweet by Matthew Gaetz, Representative Matthew Gaetz, to be precise, in which he said that he's very upset about the $350 million for migration and refugee assistance that was essentially hidden in this stimulus package. Here is a clip from his interview on Fox News with regard to that earmark.
As Senator Graham works to fix these unemployment problems you've been talking about in this bill, I sure hope he'll try to take out the $350 million for migrant and resettlement for refugees in our country. Why in the world do we have $350 million for migrants and refugees before we restore the economic condition of every American in our country? And oh, by the way, Sean, no money for Border Patrol and ICE in this bill, but you see the Democrats, just as Governor Huckabee said, doing everything they can to socially engineer through a crisis.
Incidentally, I was just speaking to people in Mexico about how the smuggling operation of these folks in the Border Support Network is currently going. And I've heard that Father Solalinde has made a statement basically saying that they're done. For now, during the pandemic, their business has effectively been stopped. It's dried up.
Yep.
There still continues to be some smuggling happening across the border, but it is essentially finished for now. And it's very interesting that they would earmark $350 million for resettlement and for migration for immigrants when, there has been a halt to that, unless there is some interest in maintaining it.
Or even current families and stuff. We don't know. I mean, the bill, you couldn't even read it. I don't even know if you can get a copy of it today. Maybe you can. But it's like they negotiated. I mean, both sides negotiated. Democrats and Republicans negotiated what they wanted in this bill. So there was give and take. I don't know the reasoning for that, or what the program needs are. But there are resettlement agencies all over this country that still need money to do their work. And, they're not going to be bringing in a whole bunch of people from other countries right now. But they have the existing work that they're still doing with people who are already here. So, it might have something to do with that. I'm just guessing. But at the same time, the bill is like, I don't know how many pages, 800 and some, So to get a copy of that and read through it to see, maybe call my congress member and ask.
Well, I was speaking to people in Mexico about how people are dealing with the response in that country, and one of the things that I was told was that the people are becoming much more nationalistic in their approach to requesting support. They want the president to focus on the Mexican people, not foreigners, not outsiders, not immigrants. They want a response, and they want it yesterday. And by the way, Alicia is asking me, what happened with the asylum seekers in Tijuana? Are they still there? Alicia, I'm going to be bringing you this weekend a report, an update with Border Network News from Oscar El Blue Ramirez. I'm not sure if Anthony's going to be joining us, but I would love to have Anthony join us as well to get an update from them and what's going on at the border, specifically in Tijuana, in Mexico and Baja California, with the medical system's response and more. So stay tuned for that. I will be bringing you all of that information. And what better way to do it than Border Network News' reporter this weekend? So focusing here on the U.S., let's go to what's happening specifically at the epicenter in the U.S., which is New York City. Here is a doctor relaying what they are dealing with.
All the patients in this room, all the feet that you see, they all have COVID. The frustrating thing about all of this is it really just feels like it's too little too late.
Dr. Colleen Smith.
We knew it was coming.
Dr. Colleen Smith gave us a rare look inside an overstretched ER in New York City, the epicenter of the COVID outbreak.
And there's patients.
Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying. We are right now scrambling to try to get a few additional ventilators or even CPAP machines. If we could get CPAP machines, we could free up ventilators for patients who need them.
They got a shipment of ventilators from another hospital a few hours later. Dr. Smith said it was a third emergency resupply in a week.
Five ventilators. Oh my God.
The head of New York City's public hospitals denied that Elmhurst had ever come close to running out of ventilators. A statement to the Times said they continue surging supplies and personnel to Elmhurst, which is the number one priority of our hospital system.
We now have these 5 vents. We probably, unless people die, I suspect we'll be back to needing to beg for ventilators again in another day or two. There's a mythical 100 vents out there, which we haven't seen.
Hospitals and state officials say dwindling supplies will soon become a major problem, but hospitals are keeping up for now. Dr. Smith says the shortages are already here for workers on the front lines.
Leaders in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine. I don't have the support that I need, and even just the materials that I need physically to take care of my patients. And it's America, and we're supposed to be a first world country. On a regular day, my emergency department's volume is pretty high. It's about 200 people a day. Now we're seeing 400 or more people a day. At first, we were trying to isolate patients with cough and fever and be more careful around them, but we weren't necessarily being extra careful around all the other patients. And then we started to realize, so someone in a car accident gets brought in, we get a CT scan of them, and their lungs look like they have coronavirus. We were seeing a lot of patients who probably had COVID, but we didn't realize. 10 residents and also many of our nurses and a few of the attending physicians got sick. The anxiety of this situation is really overwhelming. You know, all of the doctors, it's hard for us to get tested even if we want to, even if we have symptoms. We're exposed over and over again. We don't have the protective equipment that we should have. I put on one N95 mask in the morning. I need to have that N95 mask on for every patient I see. I don't take it off all day. The N95 mask I wore today is also the N95 mask I wore on Friday. We're always worried that we'll be out of N95 masks.
Dr. Smith says the hospital is adapting as fast as they can and set up a tent outside to test mildly sick patients. But these fixes haven't minimized the pressure.
What's a little bit scary now is the patients that we're getting are much sicker. Many of the young people who are getting sick don't smoke. They're healthy. They have no comorbidities. They're just young, regular people between the ages of 30 and 50 who you would not expect to get this sick.
FEMA is expected to bring more supplies. But Dr. Smith says that there has been a lot of promises that have yet to materialize in the ER.
So many people are saying it's going to be okay, everything's fine, we have what we need. And if this goes on for a month or 2 or 3 or 5 like it did in China, and we're already this strained, we don't have what we need. I don't really care if I get in trouble for speaking to the media. I want people to know that this is bad. People are dying. We don't have the tools that we need in the emergency department and in the hospital to take care of them. And it's really hard.
That's terrifying.
Wow, it is.
That's terrifying. And I know that hospitals around the country are now feeling that pressure, feeling this, burnout, this burnout that's going to happen. And we haven't reached peak, folks. That's what you got to remember. Alicia comments that back in January, her mom was hospitalized for pneumonia, and she had to be on BiPAP with 7 liters of oxygen. Thank God that she survived, but now her kidney function is at 4%, and currently she has to be on dialysis, and she suspects that she may have had COVID. And you know what, Alicia? As the president said today in his press conference, there's a lot of people that probably had it in December, in January, never got tested, survived it, and went on. And who knows how many people are like that? Probably thousands and thousands. So that's, of course, very concerning because we don't know what that means. Those people don't make up part of the numbers that we're tracking right now. And another comment from Lori says that the hospitals in South Carolina have just come up with an adapter that uses 1 ventilator for 4 patients.
Okay.
And they need to use this in every hospital across America. That would be amazing, and I'm sure that they are doing everything they can to make that available to other hospitals. Folks, we can't leave our healthcare workers just blowing in the wind. They need to have the equipment that they need. Take a look at this image from New York hospitals where nurses are now wearing trash bags.
Yeah.
hefty trash bags
Mm-hmm.
to protect them
As
as
gowns,
protection
yes. Wow.
from the COVID virus.
They don't have the proper gear.
This is unacceptable, folks. We are the most powerful and richest country on the planet Earth, and our healthcare workers in one of the biggest, most well-resourced, especially with regard to medical supplies and beds and and equipment, New York City.
Mm-hmm.
Our healthcare workers have to wear trash bags? Folks, this has got to be handled in a different way. And I know that we're going to see a lot more coming from healthcare workers that are whistle blowing on what is going on with them. Here's another tweet by somebody that works for Alina Health. And you can see in their garage, there's a plastic bag of some sort on the ground. And on top of it is the medical scrubs that they used for their work today. It says, here in my state, the Art Infectious Materials treatment facility for where I bring my scrubs home for
From the ER.
from the ER. So this is his facility, this place where he takes it, because they don't have an indicated place for them to take all of their clothes. They're supposed, basically, on top of working these rigorous hours during a pandemic, they have to wash and treat and sanitize all of their own clothing. They have to take that coronavirus-covered stuff to their homes and take care of it and treat it, and then go back to work again. Go back to the front lines. We wouldn't send, well, I guess we have sent soldiers in to fight without proper equipment, but we shouldn't be doing that. And this definitely is just like a war scenario. In hospitals right now in New York, they're having to make the gut-wrenching decision to not resuscitate patients that code.
Okay.
This is practically the same kind of impossible, unethical types of decisions that no doctor wants to make. But this is what happened in Italy, where they decided not to treat older patients at all. And it's what's going to happen, already is happening in New York, where they are going to decide to not resuscitate people that code. So if you have a heart attack, they're just going to let you go.
Wow.
They don't have the means, the time. And the reason for this is, folks, that from the time that that monitor goes off and you're in code blue, a bunch of medical staff have to gear up in hazmat suits to come and treat you, because during an invasive procedure like a resuscitation, there is all sorts of contaminants flying everywhere. It's a very violent procedure, if you've ever seen a resuscitation, and therefore they wouldn't have enough time to get into the proper gear to protect themselves, nor do they have enough of that gear to constantly be changing in and out before they go to another patient to stop these folks from dying of a heart attack. That is why they're going to choose to not resuscitate. And these are the heartbreaking situations that we're seeing across our country. Also, chloroquine, the medicine that the president was talking about is being tested as a possible treatment for COVID, is now in short supply. Doctors are stockpiling prescriptions for themselves, for their friends, all across the country. By the way, the medical board in every state should be investigating these doctors, fining them, pulling their licenses, and punishing them. This is a horrible abuse of their medical license. And in addition to that, patients that require medications for their immunosuppressant diseases cannot get them. A woman with lupus said that her healthcare provider is stopping her chloroquine prescription and thanked her for her sacrifice, quote unquote. That's the most disturbing part. It wasn't like she signed up to be a soldier in a war.
Thank you for your service.
Yeah. It's like, thank you for your sacrifice. So this woman who has lupus, she's a 45-year-old woman, said that she received an online message from her healthcare provider saying that they will no longer fill her prescriptions for her hydrochloroquine prescription. And she is, and they told her that it was being used to treat the critically ill with COVID-19.
Well, we're giving other people your medicine.
They're giving other people her medicine. She started crying when she received this message from her doctor's office. Because this is a major healthcare network, the Kaiser Permanent, that she received this from. And this is the letter that they actually sent her. It says, due to the COVID-19 pandemic, there's a worldwide shortage of planquenil or hydrochloroquine. We are therefore conserving the current supply for those who are critically ill with COVID-19. We're working very hard every day, doing everything we can to find ways to replenish this medication as soon as possible. But during that time, you should continue to take the remaining pills that you have on a schedule, unless otherwise instructed by the prescribing physician. Please do not contact your physician about an exception process to get a refill, as prescriptions will not be refilled even if you have a note written by your doctor. Hydrochloroquine does not, it builds up in people's bodies at a level in the system, that you have to build it up over time. So what you realize is that when these folks go off of their medication, it's going to take a period of time before they can get back on it. And then it's going to take time, even when they get back on it, to build it up in their system to the point where it's effective again. And the letter goes on to tell this woman that because of the way that this builds up in the body for an average of 40 days, even after the last dose is taken, if you run out of the medication and feel that your condition is significantly worse, you can contact your doctors to discuss alternative treatments. Thank you for your sacrifice you will be making for all of those that are critically ill. Your sacrifice may actually save lives, and we appreciate your understanding. You will be notified of any changes in the policy. Except that she didn't ask to sacrifice.
Yeah.
This person and many people that have similar illnesses, they didn't ask if they wanted to just sacrifice their health and well-being so that this medication could be tested. Remember, we don't even know if it is effective in treating people in a general way. Sherry comments that this is crazy. She feels very sorry for this patient. Apparently, many are being prescribed the Plequenil quite just in case by celebrities and wealthy people. Isn't that disturbing, dude?
It is. And again, that was the first thing I was thinking when you were reading that is like, they don't even know that this stuff works. And if they're having to take it from existing patients that actually use it for a bona fide treatment, is there a shortage of this too? I mean, why would they have to do that if there's plenty of? So even if it does work and they don't have enough for people to actually still use it, then there's going to be a shortage to actually implement it. So it's very backwards. It's like these things, people coding, not being resuscitated, people being taken off their medication so they can test it. It's just the beginning of the blunders, I believe, that we're going to be going through.
Well, there's another medication that is being looked at as a possible treatment. The Cuba's interferon is being said to be effective against the coronavirus. Helen Yaffe, a specialist in Cuba and Latin America, developments at the University of Glasgow, has testified that Cuba's interferon alpha 2B is now being used to combat the effects of COVID-19. It was used in China, and she wrote this in a blog published by the London School of Economics on March 18th. Yaffe said Cuba was able to develop the drug because of its early entry into the biotech industry, which allowed them to harness international expertise and develop medicines to fight dengue fever and meningitis. COVID emerged in the Chinese city of Wuhan in late December of 2019, and by January of 2020, it had hit Hubei province like a tidal wave, swirling over China and rippling out overseas. Now, the Chinese state rolled into action to combat its spread and care for those infected. Amongst the 30 medicines chosen by the Chinese National Health Commission to fight the virus was a Cuban antiviral drug called interferon alpha 2B, which has been produced in China by the Chinese-Cuban joint venture Shanghubert since 2003. Cuban interferon alpha 2B has proven effective for viruses with characteristics similar to those of COVID-19. Cuban biotech specialist Dr. Luis Herrera Martinez explains that, quote, its use prevents aggravation and complications in patients reaching that stage that can ultimately result in death. So a lot of people, again, are getting to that point where they have that chronic respiratory disease, acute respiratory disease, and that's when they have to be put on ventilators. And more doctors are coming down with the COVID virus as those people are taken out of the healthcare system. We're going to see an even larger problem. Like, for example, this doctor in Iran, Dr. Shireen Rouhani, lost her life while treating coronavirus patients. Due to the lack of doctors and medical staff to assist her, such large numbers of patients, she kept treating patients until her last breath. You can see her here pictured sitting next to an IV that she has attached to her. She herself was on an IV while she was treating patients. I mean,
wow.
I certainly shudder to think that this is the future of what we will see in America, but we already know that healthcare providers that don't have adequate personal protection equipment are out there, and they've come into contact with people that have the virus and that they are falling ill. So hopefully we don't have a bunch of our own people and first responders falling ill and dying to add to this tragedy.
Yeah.
Meanwhile, we have COVIDiots like this New York influencer, this influencer that was featured in the New York Post that has now been hospitalized after licking a toilet as part of these stupid online challenges. This is what could happen if you're a COVIDiot.
Yep. Other
COVIDiots spread misinformation. This one is from Standing Rock Phony, but also indigenous self-proclaimed indigenous influencer and leader Phyllis Young about the coronavirus being lodged in your throat for a number of days and how you can simply eliminate it by gargling with water and salt or vinegar.
Oh my God.
This is not how you eliminate the COVID virus. You cannot eliminate the COVID virus by gargling with water, not even hot water. Stop spreading this kind of information that misleads people, especially in Indian country. Thank you very much. And of course, we have LaDonna, another one of the Standing Rock Phonies, featuring a petition for the COVID-19 and the Green New Deal. How the heck are those two connected?
I don't know how.
There's a poster of Jane Fonda and Alexandria Ocasio-Cortez and Greta Thunberg. Did they not get the memo that Greta's in quarantine because she likely has the COVID virus? Maybe that's the part that's the COVID virus. Greta's got it. And AOC's got a brand new deal. For those of you who continue to deny the reality of the COVID virus, it may be coming to show you how very real it is, like it did to this Virginia pastor who recently passed away from the from the COVID virus. He originally stated that the virus was an anti-Trump mass hysteria. He has since contracted the virus and died.
Wow.
And died. That's just like the COVIDiot that licked the toilet. If you don't take this seriously, you will pay the consequences. This virus is no joke and no respecter of persons. Also, as a tip, there is a way to cross-contaminate inside your home if you don't pay attention to your footwear. Are you removing the shoes that you use when you come inside and disinfecting them? Some people, like this poster on social media, has a box next to their door front, and they use the shoes that go inside in a different place. The shoes in the box are the ones that are for outside use, and it says, no shoe that you use outside can enter your home. Cross-contamination is part of prevention. So make sure that you don't bring the virus into your home on your feet. And yes, it will be on the ground. People are coughing, people are sneezing, people are spitting on the floor. There has also been one man killed after an attempted terrorist attack. We have people trying to bomb a hospital during a pandemic. How terrifying is that, Duke?
It's horrible.
The FBI says a man was killed in Missouri wanting to plant a bomb in a hospital amid the pandemic. Timothy Wilson was the subject of the terrorism investigation, and agents tried to arrest him when he arrived to pick up what he thought was a bomb. This 36-year-old man from Belton, Missouri, was killed after he died by suicide.
Oh.
He was wounded by FBI agents, or it was not clear, if he was wounded by agents or if he died by suicide, but officials said that he was armed and after being shot was taken to a hospital where he was later pronounced dead.
Jeez.
FBI officials described Wilson as a potentially violent extremist known to express racial and religious hatred and anti-government sentiments. Wow. Well, I hope we don't have any more COVIDiots or COVIDiot terrorists like that. Let's take a look at that country that has less people sick than New York City. That's Germany. What are they doing different, and how are they helping people all across Europe?
In a race against time, a critically ill patient from France makes it to Germany, where hospitals are not yet overwhelmed despite some of the highest number of confirmed coronavirus cases in the world. A fact that baffles many, even Germany's Center for Disease Control, the Robert Koch Institute, as they try to explain.
In Germany, we tested widely from the start, and that's why we discovered the virus early. And we also discovered many mild cases through it.
While the Trump administration took time to initiate mass coronavirus testing, the Germans began their campaign in early January. With a population of around 80 million, Germany says it can test about 160,000 people a week. That means fewer infections missed. While Italy acknowledges their actual number of people carrying the virus could be 10 times higher than the number of confirmed cases, the Germans believe they've missed fewer people who've contracted COVID-19. But some of it also appears to be pure luck, Berlin says. The coronavirus has simply infected younger and healthier people in Germany than in many other countries.
Not many old people are ill in Germany yet, which is also a factor that results in deaths and age fluctuations.
Germany also has a strong healthcare system with one of the highest numbers of intensive care beds and ventilators in the world, and it's currently working to double the capacity. The head of a Munich clinic dealing with at least 100 coronavirus patients tells me getting critically ill patients top-notch care without bottlenecks is also key to keeping many alive.
We had already cases just coming back from intensive care unit to the normal ward. So telling us it's possible to save lives once you get the right treatment, intensive care unit treatment, early enough in order to rescue the patient.
But of course, Germany's response is not flawless. There are many people in this country who wanted to get tested for coronavirus, but were not able to because of limited capacities. And even the German government warns the worst might yet still come.
Yeah, it's true. You know, that pretty interesting. I think it's really interesting information. You know, we'll see how it pans out. You're listening to KPPP LP 88.1 Fargo Moorhead, adding local color to your airwaves. And welcome to our program tonight.
Yes. Well, you know, I think that the most interesting thing about what the Germans have done, obviously, they've tested most of their population, or they think they have. They started their testing months in advance of us.
In January.
Even though this was hitting Europe, right around the same time. And frankly, I think that testing, access to testing, widespread testing is going to be what really turns the tide in the United States, just like it has done in so many other places. We need more tests, especially for our frontline healthcare workers and first responders who are putting their lives on the line. We need to give these same tests or make them available to all of the essential workers. Who am I talking about? The National Guard.
Yes.
Who am I talking about? The people that are delivering your food, the people that are working in those grocery stores, because they're going to quit their jobs. They're going to quit. You're not paying somebody at a grocery store enough for them to put their life on the line for you. You're not paying them enough. We need to get them testing. The other thing I heard is that if you get ICU ventilator intervention early enough in the process, that makes a huge difference. But we're not putting people on ventilators till they're literally on their last leg because we don't have enough of them. So a lot of what is killing people is the fact that we have an overwhelmed system that can't get the help to people early enough. Folks, I wanted to share what is happening across the border, just a teensy-weensy bit. I'm going to be bringing you, again, as I said, a more in-depth report this Saturday or Sunday, yet to be announced. I will let you know. Check our social media page on Facebook to find out what time we will be doing that broadcast. But I'm going to be asking Oscar to fill me in on what Mexico is doing about people crossing into Mexico. Apparently now, Mexicans are demanding a crackdown of Americans crossing their border. They don't want the coronavirus. So Mexican protesters have shut down a U.S. border entry point amid fear that untested American travelers are going to come and spread the virus in their town. They don't like the fact that Americans are still coming into their country. They were, wearing face masks and holding signs telling Americans to go back home. All of this took place in Sonora. The residents of Sonora, this is just across the border from Arizona, they promised to block traffic for a second day after closing a checkpoint for hours on Wednesday. And they want additional screening. They don't like the fact that, in addition to the fact that people are still crossing into their country, they're not being screened. They're not being checked. There are no health screenings by the federal government to deal with this pandemic. That's why we're here in Nogales. We've taken this action to call on Mexican President Andrés Manuel López Obrador to act now. The Mexican president has been criticized for his response to the pandemic, as has U.S. President Donald Trump. Mr. Hernandez said the Wednesday demonstrations were a first warning to Mr. López Obrador, popularly known as AMLO. The group has called for enforcement of the crossing ban on all U.S. or Mexican citizens for tourism or for medical reasons, including those who cross the border every day to attend school or work in the U.S. Authorities must also conduct medical testing on Mexicans deported from the U.S. Even the Mexicans that are being deported back to the U.S. pose a risk because they could be carriers. And you know what? In playas de Tijuana, people are still not getting the memo. So many people are still congregating on the beach in playas de Tijuana that the government is now threatening to close it because no one believes in COVID-19. They don't believe it.
Just don't believe it.
They don't believe it's real. It's crazy. Folks, here are some of the nice things happening in the world. Texas Roadhouse, the CEO of the restaurant chain, the Texas Roadhouse, is going to give up his entire salary for the year plus his yearly bonus so that he continues to pay his workers during the pandemic.
Good, good.
See, that is that American ingenuity that I knew, the American resilience that I talked about on my show yesterday that we have. In Arizona, in Tucson, the restaurant La Cocina served free meals to restaurant workers laid off because of the coronavirus.
Oh, cool.
That is very cool. And if you have stories of people doing good work in their community, in your state, let us know. We'd love to feature them. And we will remember after this crisis who stood up for America, who stood up for Americans, who stood up for workers, and we will honor them and we will patronize them. So let's bring in all of those stories. I also want to share with you what the stakes are in Italy, the things that are happening there with their medical system. It's pretty harsh to see.
683 lives lost in Italy today alone. Doctors and nurses there are on the forefront of an uphill battle, putting their lives on the line to try to save thousands of patients that come through their doors. Maggie Rulli has this report.
For the past few weeks, it seemed Italy was losing a war with the invisible enemy. But in the last 3 days, Italy's reported cases have slowed. A glimmer of hope for a situation that's ever more dire. Over 70,000 infected, more than 7,000 dead. It's taken an international effort to begin to contain Italy's cases. The Chinese brought their ventilators. The Russians deployed medics and supplies. The Americans posted on the front lines.
We just finished in the women's ward giving their morning medications. We're not able to let them go until the symptoms of the coronavirus are resolved. So they end up being here for quite some time, which can be challenging for them. Now we're gonna pop into the ICU and check on them and see how they're doing and what kind of help they need.
A constant race to keep up for those at the forefront of this battle. Every minute critical.
I would say that we are at the end of our strength. We do not have sufficient resources, and especially staff, because apart from everything else, now the staff are beginning to get sick.
And with supplies always running low, every decision counts. In this case, it means forfeiting basic needs in order to save lives.
Every hospital is lacking in these days of protections, like masks, like cover for the shoes. We cannot, for example, during our shift, go to the toilet, because this will mean to change and to change again. And this is a waste of protections.
Despite the help from others, it's still not enough. Italy turning a passenger ship into a floating hospital.
We don't have enough places for everyone.
But it's the very places that care for the sick that seem to be hotbeds for infection, taking the lives of many of the nation's caretakers. In Italy, at least 30 doctors have died since the outbreak. Officials warned it was just a matter of time before Spain saw their numbers skyrocket too. And they have, the country reporting astounding numbers despite its strict lockdown. Nearly 50,000 cases, of those, thousands of healthcare workers infected.
When I saw that within 12 hours of taking the test they were calling me, I knew that something was not right and that I was positive.
In this video circulating on social media, patients on the floor of this hospital, some heard coughing. Field hospitals that look like they belong in war zones, now a common sight there too. And around Europe, preparing for the worst to come. Italy is proof that it's imminent, that unless countries get more testing, more beds, more doctors, more supplies, they'll likely face the same fate and see the same heart-wrenching scenes of caskets silently waiting to be laid to rest.
And Maggie Rulli joins us now. Maggie, just an awful situation there, and a warning to the rest of the world for those doctors on the front lines. Now, in retrospect, do they think that they could have done anything more to prepare themselves?
Yeah, Lindsay, I spoke with some of these doctors earlier today, 2 out of a Milan hospital that's been hit so hard, and they both told me the same thing. They just wish that they had more time to prepare, to get ahead of this. They said that, they need more beds, they need more ventilators, they need more of that personal protection equipment, they need more doctors, more trained nurses, more of everything. They're just so exhausted. And what really stuck with me is they said, looking at America, looking at Europe, rest of Europe, you guys had time to prepare. You have time to get ahead of this. You should be building more hospitals right now. You should be getting more of these ICU beds. You should be getting more ventilators, training more nurses. And so they really hammered that point home, that now is the time to prepare. It is still not too late, but it's getting there. And if you don't do these things, you're going to probably end up just like Italy. Tough to hear, Lindsay.
Tough to hear, but words that we probably need to hear in order to prepare. And Maggie, switching gears just for a moment, we heard a warning today from the World Health Organization about countries potentially reopening too early.
Yeah, this was interesting, Lindsay. World Health Organization coming out, really sort of pointing the finger at countries that say they want to open up early. And they reminded these countries that this could potentially be dangerous. This could infect more people. This will not be helpful for the world if countries start to open up. And they really hammered home the point that countries need to stay closed. They need to practice social distancing, practice this self-isolation. This, according to them, is the only way we're really going to start to beat this virus. Lindsay.
All right, Maggie Rulli for us in London. Thanks, Maggie.
Thankfully.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC.
Thank you for that report from ABC. But I wanted to just mention that the president did announce today that the hospital ship, the Comfort, is on its way to New York to give support to the beleaguered health system there. And Elon Musk has purchased over 1,000 ventilators and is already starting to distribute them to hard-hit places like New York. So there is a little bit of a silver lining. The question is, will it be enough? I don't know. I don't know. But what can we do right now? You can do things right now. Of course, there's hand washing, vigorous hand washing all the time, disinfecting surfaces, disinfecting public surfaces that people are going to go to, and practice physical distance. Don't go out. Stay home. If you don't need to leave, don't leave. Don't visit elderly people and don't make them leave the house. Find out how you can supply them with their food and their needs without them having to go outside, because this is a deadly virus and we need to keep as many people from overwhelming our healthcare system. Please take care of yourselves. And before we go, I wanted to give you a little funny for the day.
Oh, yeah.
This is a game I've never heard of, but you have, Duke.
Oh, Duke Nukem?
Duke Nukem?
Duke Nukem. It was the first action game that came out on a personal computer. Is I don't know when it was, 80s, something like that.
Well, using Duke Nukem's voice, the Twitter account that I shared with you came up with a bunch of pickup lines for the coronavirus outbreak. Here are some pickup lines. Duke Nukem's COVID pickup lines. Take a listen.
If COVID-19 doesn't take you out, can I? Is that hand sanitizer in your pocket? Or are you just happy to be within 6 feet of me? I saw you from across the bar. Stay there. Hey, babe, can I ship you a drink? Since all the public libraries are closed, I'm checking you out instead. You can't spell virus without you and I. Hey, babe, you need some toilet paper? Because I can be your Prince Charmin. Without you, my life is as empty as a supermarket shelf.
Those are pretty good ones, Duke. Did you like them?
Yep, and they're written by me. I am not Duke Nukem. I'm Duke Gomez-Schempp.
Oh, one last thing. I got a message from one of our followers saying that they just received a message from Verizon telling them that there's free data that's been added to help in this crisis.
That's excellent.
But we'll try to look into that and verify if there's any support for folks out there that use Verizon. That would definitely be a big support.
Definitely. And tell them to activate their radio chip in their phones, too.
Yeah, tell them to activate their radio chips, because right now, one of the best ways that you can get free updates and information and entertainment is your public radio station, like this station, 88.1 FM, KPPPLP, Fargo-Moorhead, where we are adding local color to your airwaves. Thanks for being with us tonight with Cindy Gomez-Schempp
and Duke Gomez-Schempp
on A Mexican Crossing Lines. Have a great evening and blessings to your family.